Hello, my dear doctor. I'd like to talk on hereditary spherocytosis. Just follow me what is written on the notes, right? The basics are the most common hereditary hemolytic anemia in people of the Northern European descent. Hereditary spherocytosis is the most common hereditary hemolytic anemias in the peoples of the Northern European descent. So, circle the European autosomal dominant defect of the red blood cell cytoskeleton. So circle the autosomal dominant. The word the hereditary gives out the idea there is the autosomal dominant inheritance. The normal biconcave disc shape is replaced by a sphere-shaped red blood cells. Means a spherical shape of the red blood cells. Red blood cell survival reduced by destroyed as destroyed by the spleen. Hereditary spherocytosis, you learned it, this is extravascular hemolysis. Extravascular hemolysis is done by the spleen, so there will be the splenomegaly, of course. Spleen is ready to, engulf all the abnormal shaped RBCs, means the spherical shaped RBCs. So presentation usually the failure to thrive, jaundice, gallstone, splenomegaly, aplastic crisis precipitated by the parvovirus infection, degree of hemolysis is variable, and MCHC elevated as star, mixed circle is MCHC, and diagnosis the osmotic fragility test. Yes, circle the osmotic fragility test, and management is a folate replacement and splenectomy. Compare the G6PD deficiency to hereditary spherocytosis. A very, very hot topic, very close to them. One is an cell membrane defect, another one is an enzyme defect. So left hand side you see the G6PD deficiency and hereditary spherocytosis. Gender is a male. G6PD is a male because this is X-linked recessive disorder. So we will study in the chapter of clinical science, my dear. You will see there is an G6PD X-linked recessive disorder. That the one is the age disease, the hemophilia that we'll remember, and second to the hemophilia we need to remember an important disease, that is a G6PD. So remember, G6PD is an X-linked recessive disorder. So that's why within the brackets written there's a male are the sufferer and females are the carrier. So male, only the male. So scenario starts with the boy. Yes. Females, definitely the G6PD will not be the diagnosis. Hereditary spherocytosis is the male and females. Yes, my dear. Because it's autosome, no sex differentiation. So both male and females are affected. So autosomal dominant disorder. So if the scenario starts with the females, in these differentiating points, yes, you can think of the hereditary spherocytosis. Yes. Ethnicity, write the African and Mediterranean. So G6PD circle the Mediterranean, that will be really helpful. Circle the Mediterranean. In contrast, there is a hereditary spherocytosis is a European. Circle the European, Northern European descent in your nose. So circle the European. Typical history in the G6PD deficiency, there is a neonatal jaundice and hereditary spherocytosis neonatal jaundice. G6PD, there is an infections of drugs precipitated the hemolysis. In contrast, right inside, there is a chronic symptoms, although hemolytic crisis may be precipitated by infections. Both cases. G6PD can produce a gallstone and hereditary spherocytosis can produce a gallstone. Both cases. But extra things that the splenomegaly, yes, my dear, splenomegaly is common. Left inside the blood film, there is the Heinz bodies, G6PDH. We already learned H for the Heinz bodies. In contrast, hereditary spherocytosis is a spherocytes, round, lack of central payload. Diagnostic test for the G6PDH is the enzyme, so enzyme assay. So he has measured the enzymatic activity of the G6PDH. And hereditary spherocytosis is an osmotic fragility test because of fragile or not, because of the cytoskeleton abnormality. So my dear, listen very carefully. I'd like to give a box, and these boxes are having tremendous effects to be helpful. Let's talk on that. So my dear, listen very carefully before going to the good differentiations in between the hereditary spherocytosis and also the G6PD deficiency. I would like to talk on a little bit further. That is the G6PDH deficiency. Just follow me. G means the glucose 6-phosphate dehydrogenase, means the G6PDH. Put an H in your notes. Is the most commonest or the commonest red blood cell enzyme defect. Commonest red blood cell enzyme defects. It is more common in people in the Mediterranean. I said it, circle the Mediterranean and African, and is inherited the X-linked recessive disorder. Many drugs can precipitate a crisis as well as the infections, drugs, infections, and broad fava veins. So circle the broad fava veins, right? Pathophysiology that the G6PD is reduced leads to the reductions of glutathione, and that increased red cell susceptibility to oxidative stress. That leads to the hemolysis. So features include the neonatal jaundice is often present or seen. Definitely the intravascular hemolysis, gallstones are common. Splenomegaly may be present. That make a star. Splenomegaly may be present. And Heinz bodies on the blood film. That is the differentiating point. G6PDH, H for Heinz bodies. Diagnosis made by the G6PDH enzyme assay, and some drugs causing hemolysis like the anti-malarial, circle the malarial is the word, and primaquine is a primaquine must to be known, right? Primaquine, marquine, Mediterranean, malarials, and marquine, remember, and also other sulfur group of drugs like the ciprofloxacillin. I'm saying the S for ciprofloxacillin, S for sulfonamides, sulfasalazine, and sulfonylureas. Some drugs thought to be safe. Penicillin, cephalosporin, once again the macrolides, tetracycline, as well as the trimethoprim. These are the safe drugs that we need to know. So yes, my dear, I'd like to talk on very well first the hereditary spherocytosis, then I'll talk on the G6PDH deficiency, then we'll differentiate in between the HS and also G6PDH deficiency, because these are two confusing diagnoses, yes, clinically as well as the diagnostic tests, and also some other important points that I'd like to discuss. All right. Yes, my dear doctor, I'd like to give a box, right, first of all, right, the hereditary spherocytosis first, right. Just follow me. The important box for the hereditary spherocytosis. So what I'm saying, my dear, is very important, that hereditary spherocytosis, if I'm writing the HS, so what does this HS really means? I'm saying the H for whole stone. Just write down the H for whole stones, right? I'm writing H for whole stone and S for splenomegaly. So hereditary spherocytosis, say with me, H for whole stone and S for splenomegaly. Whole stone is the gallstone, splenomegaly. Gallstone, splenomegaly is a diagnostic, more likely the hereditary spherocytosis than G6PDH. So make a box for the HS for the whole stone and as well as the S for splenomegaly. And another important box that, my dear, I'd like to write them down. There's the HS, hereditary spherocytosis treatment. So this is the important clinical features and this is the treatment. HS treatment, what I'm saying, this is really important. That is the H for folate. H for folate replacement and S for, once again, the splenectomy is the treatment. So make a box, my dear. Next, once again, another box that we are writing. Hereditary Spherocytosis, IX investigations. So what I'm writing, that's really important, that H as for osmotic fragility test. And this is very important, that the H for hemolysis. And these hemolysis means already we talked on, there is anemia plus jaundice. Anemia plus jaundice means the hemoglobin will be low, and especially we are getting a bit of normocytic normochromic anemia. And of course, the jaundice is the bilirubin will be high. So this is the bundle pack of the hemolysis, and this is the diagnostic test for the osmotic fragility test. And one of the important H that we need to remember, that is the MCHC is elevated. Just make a box. So this is the box of hereditary spherocytosis, my dear. Write them down. I'd like to talk on now the differentiating points in between the G6PD as well as the hereditary spherocytosis, but beforehand I'd like to give the box of the G6PD. So yes, my dear, just follow me the box of the G6PD. So once again, we know that there is the H for Holstone. Definitely we have the H here. So we can write the H for Holstone. So here is the gallstone is also present. And these H that we know that the H for Heinz bodies that we need to remember. And we already learned it, that is H for Heinz bodies on the peripheral blood film. And of course, in contrast to the hereditary spherocytosis is the membrane defect, and enzyme defect is the core insight. So intravascular hemolysis is the enzyme defect, and membrane defect is the extravascular. Extravascular hemolysis leading to the splenomegaly. In contrast, G6PD is an intravascular hemolysis, less likely, unlikely to have the splenomegaly. But remember, my dear, in another video clips, in contrast, and giving an example, right, the compare and contrast in between the extravascular and intravascular hemolysis that we put within the intravascular hemolysis G6PD enzyme deficiency, and we made another box. There is a G6PD having both features of intra, of course, and along with the extravascular. In that case, splenomegaly also can be present. So we can write splenomegaly, but we are not writing here. Just write down the single box, that is the G6PD, H for Heinz bodies and H for Holstones. And next important box for the G6PD. All right. We learned that G6PD deficiency, the drugs are we need to remember the P for primaquine, or you have to remember the M for marquine. Remember, as I said, primaquine we need to remember. And primaquine is the most important drug that we need to know, as an LT malarial drugs can cause the hemolysis drugs as well as the infections, as well as the fava beans. That's really important. So what are the other drugs? Drugs bundled by the S group of drugs. Yes. As well as the PDH. If I'm writing the H, just write down the fava beans. All right. Or if we can write the precipitants, right, that cause the hemolysis. So P for primaquine, S for S group of drugs like the sulfonylureas, sulfasalazine, and sulfonamides. So these group of drugs can produce, as well as the S for ciprofloxacillin all together. So this is the bundle pack of the S. And some drugs to be safe as well. So we need to write the G6 PDH, safe drug, are the penicillin, cephalosporin, then the macrolides. So just write down the pack empty. All right. So this safe pack empty, this is the bundle pack that we need to remember. Precipitants causing the hemolysis are the PDH, primaquine, as drugs, means the drugs as group of drugs, and fava beans or fava beans that we need to remember. So yes, my dear, I would like to give a summary, the compare and contrast box. That's really important. So let's talk on the left hand side, G6 PD8. In contrast, that is the hereditary spherocytosis. So definitely the G6 PD8, remember this is X-linked recessive disorder. In contrast, this is autosomal dominant because of hereditary. So definitely the X-linked recessive means only the males are sufferer, but here is the males plus females. In contrast, the G6 PDH, basically we need to remember the Mediterranean group of peoples. In contrast, there is a hereditary spherocytosis is an European group of peoples. Descent. And in both cases, the clinical syndromes can be very close. So that's why I put the syndromes are, if I'm writing, as we have written that the Holstone, splenomegaly, and because of hemolytic, means the anemia plus jaundice. If you can write the anemia, jaundice, next the Holstone and splenomegaly. You see the Holstone and splenomegaly. So basically, if the patient comes up with this syndrome, anemia, jaundice means the hemolysis. Next point is the Holstone, the gallstone, and splenomegaly. We should think about because of the HS. So definitely the HS is the first diagnosis, and second diagnosis is a G6 PDH. So this is the box, my dear, what I'm saying. Anemia, jaundice means hemolysis. H for Holstone, S for splenomegaly. Of course, HS, once again, the hereditary spherocytosis is the most likely diagnosis, is the most important. Next is the G6 PDH. And in both cases, the infections can cause, right, the precipitants. Next is the peripheral blood film, right? That's really important. In PVF, G6 PDH, H for Heinz bodies that we know about it. In contrast, spherocytosis, the spherocytes, hereditary spherocytes, so the spherocytes will be found. And diagnostic tests of the G6 PDH, so G6 PDH itself is the diagnostic test, G6 PDH deficiency, enzyme activity. In contrast, there is a hereditary spherocytosis diagnostic test, hereditary H for spherocytosis, once again S for osmotic fragility test is the diagnostic test. Yes, my dear, this is a very important box, SS box here to differentiate in between this two. I'd like to talk on right in between these discussions of these two hemolytic or hereditary hemolytic anemias. One is the membrane defects, another one is the enzyme defects. So mind you, listen very carefully. So starting with the first box, right, you see that the hereditary spherocytosis is an HS. Clinical features the H for Holstone and S for splenomegaly. Hereditary H for Holstone, splenomegaly. Next is an H for Holate is a treatment, and S for splenectomy is a treatment. Next, second box, third box is an investigations, HS investigation. Once again, you see there is a H for hemolysis evidence and S for osmotic fragility test is the investigations. Number 4 box, you see that the G6PD H, once again you see the H for Holston and H for Heinz bodies that we need to remember. And G6PD once again the precipitants are the PDH, you see, precipitants are the P for primaquine, D for drugs, and these drugs are ciprofloxacillin, then all age group of drugs like the sulfonyl ureas, then sulfasalazine, and sulfonamides. And H for havavins or favavins or broad havavins, that is also you need to remember. And of course, the infections, along with that, infections can precipitate also. Number 6 box is really important. You see the G6PD, the safe drugs are penicillin, cephalosporin, macrolides, yes, tetracycline, also the trimethoprim is written in your notes, my dear. So we need to the PC or PAC-MAT. That will be helpful. Number 7 is the most important box here. That is the anemia, jaundice, and Holstone and splenomegaly. Anemia, jaundice is an evidence of hemolysis, and Holstone is a gallstone, and also the splenomegaly. So HS, Holstone and splenomegaly diagnosis done, hereditary spherocytosis, HS. And second is the G6PD. So how to differentiate in between these two? So differentiating points, you see, this is the X-linked recessive disorder, and this is autosomal because hereditary, once again. And this is G6PD is the Mediterranean. In contrast, hereditary spherocytosis is an European descendants. And H for once again the Heinz bodies is the peripheral blood. In contrast, the spherocytes in the hereditary spherocytosis. And once again, you see the G6. Once again, G6 PDH, and this is the osmotic fragility test. So the HS, once again, osmotic fragility test, the diagnostic test, but in PVF, we'll get the S for spherocytes. So my dear, listen very carefully in these differentiating points. Hemolytic anemia, anemia jaundice, young person, because these are the hereditary anemias, hemolytic anemias. So young persons come up with the hemolysis evidences, anemia and jaundice, along with the Holstone and splenomegaly. Holstone and splenomegaly diagnosed hereditary spherocytosis. A very important clue you see, this is the G6PD is the male, and a hereditary spherocytosis is the male and females. If it is something like that, and young female, a young female comes up with the hemolysis evidences means the anemia and jaundice. You examine the patients, you got Holstone on ultrasounds, and you got in splenomegaly, or maybe the splenectomy done, you examine the patients, AHS. So definitely the diagnosis AHS, you see the diagnosis, the AHS is a likely diagnosis. Young female, my dear, what I said, you see the female. Female means the AHS, hereditary spherocytosis. So if something like that, even if it is the male, young female, the same categories, definitely the AHS is the diagnosis more likely than G6PD-H. But the question, hereditary, so both male and females can be affected. But I said that the AHS, Holstone and splenomegaly, of course, the diagnosis, of course, the hereditary spherocytosis, the likely diagnosis. So this is very important, but the female is never, all right, female patients is never. So G6PD-H is not the diagnosis because of females, all right, you see the females. But here, if the patient is a male, is a similar points, so diagnosis can be AHS and G6PD-H both, but more likely AHS, as I said. H for Holstone, S for splenomegaly. This is very important, my dear. Holstone, splenomegaly, young female. Think about diagnosis, hereditary spherocytosis. And the treatment that we need to know, the summary box. If you go to the summary box, you see the summary box of the AHS is nothing but the AHS. Second box is the G6PD-H, is the drugs is the G6PD-H. And once again, you see the H for Holstone, yes, and safe drug, the PAC-MAT. And the summary differentiating points, you see the H for the Heinz bodies, all right, and the diagnostic test by the G6PD-H enzyme deficiency. In contrast, the osmotic fragility test. Once again, I'm saying young female, gallstone, yes, Holstone, splenomegaly, young female, anemia, jaundice. Think about HS, splenomegaly, Holstone, splenomegaly, HS, Holstone, splenomegaly. Hemolytic evidences means anemia, jaundice, young females, all right, diagnosis done, hereditary spherocytosis. Diagnostic test, hemolytic evidences, yes, hereditary spherocytosis, spherocytes, as well as the osmotic fragility test, my dear. I hope that you enjoyed. Thank you very much.